we'll go back to House File 2084. Sorry, everyone. So I'll move 2084 so it's before the committee. It will be laid over for possible inclusion. Representative Jordan, to your bill, House File 2084.
Thank you, Madam Chair, and good morning, members. Thank you so much for your consideration of House File 2084, which provides funding for recovery community organizations in Minnesota, or RCOs. RCOs are community-based nonprofits that provide free, non-clinical recovery support services for anyone who needs help at any point in their recovery journey. This could include things like one-to-one coaching from peer recovery specialists, linked to resources to support an individual's recovery journey, such as housing, employment, healthcare, etc., and also a recovery-friendly environment to focus on their health. One point, Madam Chair, members, I think is especially important for you to understand is that RCOs are part of the continuum of care for people with substance abuse disorder. Recovery differs from treatment. So treatment is like the surgery for a torn ACL, and treatment is the physical therapy and primary care someone may work on for in an extended period of time. RCOs are culturally specific, and they fill in the gaps people need before, during, and after treatment. This is a bill to address a lack of investment by the state to support recovery. The funding in this bill is necessary as most of the services RCOs provide do not qualify as billable expenses. Minnesota lags behind other states, including Georgia, Vermont, and Massachusetts, in recognizing the necessity of RCOs and providing funding similar to the bill here. Like many Minnesotans, I have family members, friends, and people I love on that same continuum of their recovery. All of their recovery journeys have been unique, and some of them have been in treatment programs, and all of them are good people who deserve to live their lives with dignity and respect. My loved ones, like all people, need services to manage their health like any other condition. It's not easy, and like so many Minnesotans, they can't do it alone. So here to talk more about what RCOs do, I'd like to turn it over to Major John Donovan to talk about his work serving the St. Cloud area. And I also have Wendy Jones, the Executive Director of the Minnesota Recovery Connection, to answer technical questions members may have.
Thank you, Representative Jordan. And the appropriation is $2 million in each year of the biennium.
That is correct.
So welcome Major John Donovan to the committee. Please state your name and affiliation for the record and proceed with your testimony.
Thank you, Madam Chair. I am Major John Donovan, the Director of the Recovery Community Organization, the Recovery Community Network in Central Minnesota. I have a brief statement that I would like to read. Again, thank you, Madam Chair, and good morning, esteemed members of this committee of the Minnesota House of Representatives. I am Major John Donovan, a veteran of 2 combat tours in Iraq and a 9-month peacekeeping mission with the Minnesota National Guard to Bosnia-Herzegovina during Governor Pawlenty's administration. I retired from the Minnesota National Guard in March of 2018. My undergraduate degree is from St. Cloud State University, go Huskies, and my graduate degree is from Boston University. But of all the aforementioned items, the thing that I am most proud of is I am a person in long-term recovery. It's been over 42 years since I've had a drink. No matter who you are, war changes a person. Whether you served as a cook or in combat, whether you served in the infirmary or in the infantry, the experiences of being in war fundamentally change a person. You are never the same. For some, the change is hardly noticeable, but it is there. Still others have troubles readjusting to civilian life, and those changes manifest themselves in divorce, depression, drug abuse, suicide. At the Recovery Community Network in Central Minnesota, we are providing peer services to our veterans, service members, and their families. The VA in St. Cloud is great, but it still requires someone to go to them. We go to the veteran. Allow me to illustrate. Tony, a combat veteran, received a scholarship from us to attend a Recovery Coach Academy in June of 2019. This workshop provides an attendee with the skill set to become a certified peer recovery specialist. Prior to the training, Tony was staying at the Eagles Healing Nest in Sauk Center. He was unemployed, struggling with recovery, and trying to find his place in the world post his combat experiences. This is what Tony said. This training completely changed my life. Today, I am a recovery coach for Sobriety First Treatment Center, and I get to pay it forward every day. Thank you, Minnesota Recovery Connection, and thank you, Recovery Community Network, for this amazing opportunity. Ladies and gentlemen, the work we are doing is making a difference and is serving those who served us. Investing in RCO infrastructure improves outcomes for all systems of care. We are here to compete with treatment providers. We're here to complete what they've started. Thank you for your time and attention, and may God bless all of you for the honorable work that you are doing on behalf of the great citizens of this great state of Minnesota.
Thank you, Major Donovan. Looks like we have a question. I think it's Representative Novotny.
Thank you, Chair. Question for the author. How many of these individual grants are handed out, and what's the application process?
Representative Jordan.
Thank you, Representative Schultz. I think that would be a good question for Wendy Jones to answer.
Thank you. Ms. Jones, please state your name and affiliation and proceed to answer the question.
Thank you,
Welcome
Madam.
to the committee.
Thank you. Thank you, Madam Chair. My name is Wendy Jones. I'm the Executive Director of Minnesota Recovery Connection. I'm also a person in long-term recovery from substance use disorder. The question is about how many grants there currently are. This is a different grant process, and there's currently a small appropriation that is dedicated towards the funding of training of peer recovery specialists. That's handled by the Department of Human Services. There are only 3 communities currently eligible for that. Those are in Moorhead, the Twin Cities, and Rochester. Right now, there are 3 grants that have been administered through that, one of which, the grant to Minnesota Recovery Connection, we have included the Recovery Community Network and Recovery Alliance Duluth in our grant because they were not eligible to apply for various reasons in the existing statute. This is a new statute that is designed to focus on infrastructure for recovery community organizations, which provide a wide range of services, most of which are not billable. The current legislation really focuses on the peer recovery specialist workforce and training peer recovery specialists. The RCOs, again, Minnesota lacks in recovery community organizations around the state. There are none in all of Western Minnesota. This funding would enable stabilization of the existing recovery community organizations and enable growth of new recovery community organizations in areas that are not currently being served by a recovery community organization.
Thank you, Ms. Jones. Representative Albright.
Thank you, Madam Chair. Representative Jordan, is there a companion for this in the Senate that's traveling currently?
Representative Jordan.
Thank you, Madam Chair, and thank you, Representative Albright. There is not currently one introduced, but we've been working with March to work on Senate paths forward.
Representative Liebling.
Thank you, Madam Chair. My question is whether there is evidence of efficacy for this. I know there's a lot of work being done in the area of SUD to think about which approaches work better than other approaches. Is there any data in this area?
Representative Jordan or Ms. Jones?
Thank you, Madam Chair and Representative Liebling. I'll take that question. Yes, there is an incredible amount of mounting evidence, particularly nationally, about the efficacy of or the efficiency of peer recovery support services. The Recovery Research Institute, based out of Harvard, recently published 2 long-term studies about recovery community organizations and determined that they significantly increase recovery outcomes for individuals from a broad spectrum. There's significant research about peer recovery specialists when working within community systems. Minnesota Recovery Connection, for example, has been working with St. Joseph's Hospital through mHealth Fairview, working with people who are coming out of a crisis situation. Those individuals who engaged with our peer recovery specialists have shown a 76% reduction in emergency department visits and a 71% reduction in hospitalizations, 90% reduction in visits that are related to substance use disorder. And this is a statistic that's on par with the use of peer recovery specialists in other systems around the country. Other studies show comparable statistics of a 71 to 80% reduction in hospitalizations. And that's just one example of where peer recovery specialists are used. And peer recovery specialists connected to a recovery community organization stay with the individual when they leave the system, which is why RCOs are so critical. We're the filler in between the systems, and we stay with the person, not with the system. So someone may be working with a peer recovery specialist while they're incarcerated. They might leave that system. The peer recovery specialist stays with them and works with them as they navigate to other elements of the system, whether that might be employment or a drug court. So there is a lot of evidence through Harvard research, through individual states. Minnesota is lacking in its own research, and that is something that I would hope that the state would consider in the future. But there is certainly significant evidence that recovery community organizations and peer recovery support services, when they're connected to RCOs, significantly reduce costs and improve efficiency in treatment and entering treatment and sustaining recovery.
Thank you, Ms. Jones. Representative Robbins.
Thank you, Madam Chair, and thank you, Representative Jordan. I am new to this area of statute, so I was actually just looking up this section in 254B about what a recovery community organization is. And I just wondered if you could just explain for me, as a person new to this, how does this interact with faith-based groups that do celebrate recovery, or the 12-step programs and those sort of groups? What if any interaction do they have? Thank you.
Ms. Jones.
Thank you, Madam Chair. Thank you, Representative Robbins. That's a great question. Recovery community organizations differ in a few ways. One is that we honor all pathways. So recovery community organizations are grounded in the principles of there are multiple pathways to recovery, and we're not going to tell you which one is the right one for you. We're going to work with you to help you find that. And so it's not exclusive of 12-step programs or faith-based programs. I like to think of recovery community organizations as sort of like department stores, where there are a lot of options, and we have really helpful, trained peer recovery specialists who help you navigate all the options and support you as you try different things on and try to figure out, okay, this is going to work for me. Often people have, when they're coming out of a particular treatment program, they've burned a lot of bridges in their community, and they may not be able to go back to their faith. They may not be able to go back to a particular community of support that they had in the past. Recovery community organizations also serve that function as being sort of a neutral place where the participants there, the staff there, the volunteers there will help people navigate new systems of recovery and new support systems. Again, honoring all pathways, meeting people where they're at, and not doing for people, but doing with people. So think of RCOs as being a place for really helpful guides that have been professionally trained in motivational interviewing. They've been trained in recovery resource navigation, ethics and boundaries. And so that's also what differs them from, Alcoholics Anonymous or another community-based 12-step program, is that the facilitators at recovery community organizations have a certification and a professional training that goes along with that to help people navigate systems and to honor all pathways. So a neutral department store, lots of options, helpful guides that can help you pick the right thing.
Thank you, Ms. Jones, and thank you, Representative Robbins. I have one question before we go back to the bill author. Do the specialists become sponsors in the 12-step program or AA, or do they work with sponsors?
Thank you, Madam Chair. That is completely up to the participant. Peer recovery specialists are not sponsors. Sponsors are affiliated with a 12-step program, and the goal of a sponsor is to help you work the steps. A peer recovery specialist goal is to help you set your recovery goals and help you meet those. And that may include working a 12-step program. So a peer recovery specialist may be helpful in getting you connected with a sponsor, but it's not the responsibility of a peer recovery specialist to be the sponsor. And that again aligns with this philosophy of all pathways and helping someone find what works for them. 12-step programs work well for some people, but not for everyone. And so again, it comes back to being that trained, neutral professional provider that has that lived experience of substance use disorder and recovery themselves, who can help connect you with a variety of options.
Thank you, Ms. Jones. Any closing comments, Representative Jordan?
Yes, thank you, Madam Chair. One point, I received some notification to Representative Albright's question that Senator Utke included this language in Senate File 1768. So there is a path in the Senate. The Senate is interested in this. This has bipartisan support, both here in the House and in the Senate. This is something that's critically important, and it does really fill in gaps of care that we currently have existing in Minnesota. So I thank the committee for your time today and really cannot ask you enough for your support. Thank you.
Thank you, Representative Jordan. And I do believe that was heard in Senator Abler's committee. I think I recall having listened to a hearing with it being discussed. Okay, with that, members, House File 2084 will be laid over for possible inclusion in our Human Services Finance Bill. Thank you, Representative Jordan, and thank you, testifiers.